Hi, this is Mark Graben. Welcome to the KaiNexus Continuous Improvement Podcast. Today I am reading a post by Danielle Yoon. It's titled, How UMass Memorial Health Built a Culture of Continuous Improvement. If you'd like to read this blog post or comment or share it with others, look for a link in the show notes. Now here's the post. And this blog summarizes key insights from a comprehensive white paper that details UMass Memorial Health's remarkable transformation journey. There's a link to that white paper in the show notes and the blog post. When Dr. Eric Dickson stepped into the CEO role at UMass Memorial Health in 2013, he inherited what most would consider to be an impossible situation. The healthcare system was hemorrhaging money with a record $55 million operating loss, teetering on the edge of defaulting on publicly traded debt, and struggling with poor patient and staff satisfaction scores. Decision-making had ground to a halt, with executive departures leaving leadership gaps throughout the organization. Fast forward 11 years, and the health system tells a dramatically different story, one that offers powerful lessons for any organization seeking sustainable transformation through continuous improvement. Here are the key takeaways from their journey. The foundation, a management system that actually works. Rather than implementing isolated improvement initiatives, Dr. Dickson realized that lasting change required systematic transformation. Drawing from his experience with lean methodologies and mentorship from Dr. John Toussaint, the executive chairman of Catalysis, he developed the UMass Memorial Management System, a comprehensive framework that's now in its 16th iteration. This isn't your typical management document that gathers dust on a shelf. The system consists of 9 standardized processes that create alignment from the C-suite to the front line. These are strategic planning and execution with regular catch-ball meetings, annual goal setting, alignment, and performance management to align on true north metrics, daily continuous improvement that engages every caregiver, large-scale improvement events for major opportunities, standards of respect creating a cultural foundation, operating budget processes with accountability measures, business development and capital investment processes for business opportunities, system development and support services to deliver value, and philanthropy for identifying and cultivating potential donors. What makes this system unique is its living, breathing nature. It's updated annually with leaders reflecting on what's working and what's not, and what can be sustained without formal support. So there's 3-level engagement from executives to the front lines. The genius of their approach lies in its structured 3-level engagement model that ensures alignment and communication flows both up and down the organization. There's the system level, monthly. Core leaders, including presidents, senior vice presidents, and CFO, review strategic plans, priorities, and key performance indicators. There's the entity level, which is done monthly. Leadership teams from major departments review KPIs and progress on initiatives that support the system's strategic plan, maintaining alignment while addressing local needs. And the departmental level, which is done weekly. This is where the magic happens. 583 teams meet weekly in huddles where managers and frontline associates discuss performance, identify improvement opportunities, and follow up on previous ideas. The power of frontline ideas, 132,000 and counting. Perhaps the most impressive aspect of the system's transformation is its systematic approach to capturing and implementing frontline ideas. Through its Innovation Station platform, which is built on KaiNexus technologies, and their structured huddle process, it's generated, at the time of the writing of this paper, 132,000 frontline staff ideas over the past decade. And that number is actually now greater than 200,000 staff ideas implemented. This isn't just about suggestion boxes. The health system created an innovation fund that has distributed $11.1 million in grants since 2015 to support idea implementation. In the fiscal year 2023, 93 ideas were funded with $1.1 million. And by September 2024, 88 ideas were funded at $1.1 million. Dr. Dickson's philosophy on management perfectly captures why this works. He says, you have a choice. You can be a manager who wants to come in and think you know how to do everything and tell people what to do, and your people will make you fail because they don't want to be told what to do. Or you can be a manager that comes in every day and says, we have to achieve this. What are your ideas and how will we achieve that? And again, since the paper was published, they have continued its momentum with frontline ideas approaching and surpassing 200,000. That's a testament to the sustainability of their continuous improvement culture. Transformation by the numbers. UMass Memorial Medical Center earned a 4-star CMS rating, up from just 1 star when Dr. Dickson became CEO. The rating reflects overall quality across patient experience, safety, care effectiveness, readmissions, and mortality. Other transformation results include patient satisfaction scores jumped from the 10th percentile to the top quartile. Emergency department median length of stay was reduced from a baseline of 247 minutes to 298 minutes. Radiology-related avoidable bed days decreased by 97%. They achieved the highest bond rating in the system's 35-year history. Over 3,400 staff members achieved yellow, green, or black belt lean certifications, and 24% of green and black belts are physicians. So what are some key success factors that made a difference? 1, CEO leadership and commitment. Dr. Dickson doesn't delegate transformation, he leads it. He personally meets with all managers every year, spending most of the time listening to their frontline challenges and ideas for improvement. 2, systematic approach to change. Rather than random improvement projects, every initiative connects to strategic goals through its management system framework. 3, a data-driven culture. The health system transformed from a data-poor environment to having dashboards and data for everything, enabling evidence-based decision-making and continuous monitoring of improvement efforts. And 4, respect for people. The foundation of everything is their standards of respect. Acknowledge, listen, communicate, be responsive, be a team player, be kind, everyone, every day. So what are some lessons for other organizations? The health systems journey offers several critical insights for organizations embarking on continuous improvement transformations. Start with True North. Define where you want to be before determining how to get there. UMass Memorial's True North of being the, quote, best place to give care, best place to get care, guides every decision. Secondly, systems thinking beats project thinking. Individual improvement projects have limited impact, but systematic management processes that engage everyone every day creates sustainable transformation. Frontline engagement is non-negotiable. That's third. The people doing the work know where the problems and opportunities lie. Creating systematic ways to capture and act on their ideas is essential. Fourth, culture change takes time. Their transformation wasn't immediate. Early improvements were slow, but the systematic approach created a snowball effect that accelerated over time. And finally, leadership behavior drives everything. True transformation starts with leadership buy-in. At UMass Memorial Health, Dr. Dickson exemplifies this principle, setting the tone from the top. As he explains, quote, I believe that we should have standardized, continuously improved management processes, including processes to engage every one of our people every day in daily continuous improvement. The path forward. Dr. Dickson's ultimate goal isn't just improving the health system, it's in creating a model that other healthcare systems can replicate. Through partnerships with the organization Catalysis, they're opening their doors to other public hospitals, sharing their management system and practices through site visits and knowledge transfer. The UMass Memorial story proves that even organizations facing seemingly insurmountable challenges can achieve remarkable transformation through systematic, continuous improvement approaches. The key is building management systems that engage every person every day and moving toward a clearly defined true north. Again, you can access the full white paper on the UMass Memorial Health transformation journey following a link in the blog post. This has been Mark Graben, a senior advisor with KaiNexus. Thanks for listening. To learn more about what we do at KaiNexus, how we support organizations like UMass Memorial Health, go to kainexus.com. Thanks for listening.